Our next speaker is Rohan Kumar Chariwala. He is from Navsar, Gujarat. He runs an NGO, Shubham Netra Seva Trust, which is dedicated to the tribal areas of Gujarat and Maharashtra. So he is sharing his valuable talk on how to make NGO self-reliant to achieve curable blindness. Over to Dr. Rohan.
Yeah. Thank you. Namaste, Assembly and Chair. I thank AIOS and Dr. Rustagi sir for giving me this opportunity to speak on the crucial aspect of any NGO or any eye care service provider, that is sustainability. So, sustainability is a vast issue. There are so many definitions and all, but ultimately it boils down to the particular NGO, their milieu and everything. So we have to categorize it and tailor it according to one's own needs and resources. So I acknowledge right here Dr. B.R. Samanna sir and Arvind Eye Care System for some of the tips from them. So sustainability is defined as a health service operated by an organized system with the long-term ability to mobilize and allocate sufficient resources for activities that meet individual or public health needs, and it does not affect the future generation also when we are not part of that particular system. So it's like mix of social, environmental and economic parameters. When we are talking about socio-economic things, the sustainability portion is equitable. The equitable distribution must be there. For bearable thing, we need social and environmental interactions, and to be viable, we need economic support along with the environmental support. So the components are technical, social, political, financial and managerial. As far as technical sustainability is concerned, we need to think of staff training, skills. Managerial things includes organization, delivery system, marketing, etc. Financial includes cost reduction, containment, recovery, and most importantly, the leadership of any organization. So as far as financial sustainability is concerned, it's a cost recovery or the fiscal solvency. The notion is to meet all financial needs through internal resources on which the program has full control. Internal revenues must be more than cost of the eye care services, then only it is like sustainable. Financial sustainability has four components. One is cost containment, which includes following, you can see in the busy slide: cost reduction, cost recovery and cost sharing. Cost recovery is like income generation over which we do not have any control, and cost containment which can be controlled. So on the income side, we can see it's a stable source related to the core activity and focusing on the quality and pricing. Expenditure needs good accounting system, good information system and focusing on the productivity, resource utilization and its appropriate use. So the same slide repeating, so I'm just skipping it. Sustainability has four components, which is human resource development. If it is good, we can attain that. Good management, good patient-centered organization, as Dr. Rathi madam said, that the WHO has like people-centered eye care delivery, and it must be integrated to the government system. So we need to be working in tandem with the government sector or other sectoral connections. Then comes the cost-effective and optimal resource utilization. Cost recovery depends on the sustainability, marketing, satisfaction and quality of the care we provide. So we need to be very, very careful when we think of sustainability. It involves so many things. As far as framework is concerned, we have to contextualize the factors. Activity profile of an NGO is utmost important. If one NGO is working in a urban setting and one in a rural tribal, one in hilly terrain, we have to tailor it accordingly. It deals with the capacity, capability and competence, collaboration and cooperation, culture, clarity, camaraderie, commitment, continuity, and catching up with the innovation. As Dr. Marwa pointed out, artificial intelligence, the new techniques must be employed to minimize the resources. So ultimately, quality drives the sustainability, and quality must be assured at all level of eye care delivery as well as at our service programs or projects. So foundation of the sustainable eye health programs that depends mainly on leadership, who is on the leadership position. Then the managerial competence is also very important. Clinical competence is also important, as the quality we give out to the community, the people will have faith in us and will avail the facility. Process to sustain the above are the foundation of the sustainable eye health care programs. So guiding principle for sustainability are as follows: doing what needs to be done in that particular setup, doing it right, having a process that continually ensures the above, having a long-term perspective without compromising current needs. Now the main issue is cost recovery. How it can be done? So cost recovery drivers are many. So one is quality of eye care. Well-trained eye surgeons, doctor and staff must be there. With the standardized protocol, everything must be done. Appropriate equipment and instrument must be used. And for cataract patient surgery, intraocular lens and other consumables must be good in quality. Quality of services also includes timely attendance of the staff. If doctor comes late and our surgeries are delayed and the patient are waiting in OPD, it's like mess we are creating. So that is also very important. Treatment, counseling, patient satisfaction measures, as Sir rightly told us, that the feedback is very important. So regular feedback is necessary. Efficiency, scheduling of the operations as a flow of the patients, planning of the tomorrow and day after tomorrow, or weekly planning must be there. And human resource adequacy and training, the regular training is also very important. Cost recovery drivers includes outreach services also, which includes service marketing. We need to take measures to increase patient volume, addressing barriers to eye care. Counseling services must be strengthened, and we have to manage with the best practices available. And positive ergonomics must be there. That means right people for right job at the right time in the right place, which we learned from Arvind Eye Care System. Policies and standards are up to the mark, whether it is accounting, whether it is management, and we need to monitor thoroughly. Quality and accountability. No Ram Bharose thing. We need to be evaluating our projects, plans and everything. Cost recovery models are many. I am not discussing it. There are so many countries which have successful models. Now comes the demand side financing. Demand side financing are the that channels a part of subsidy for eye care services directly to the patient, allowing them to avail the services. Which are the issues then? It target the poor, lack of the user choice, and no linkage between performance and a provided payment. Patient want to come, but there is no, what can we say, linkages. So now the WHO has also emphasized more on referral linkages. So also the government of India, which has come up with the health and wellness system document guideline, which I am the part or contributor, where we are also discussing this thing, that we need to be having that referral linkages. Without that we cannot do it. As Dr. Rathi madam told, that we need to give them proper contact details. So patient को देखा और उनको यहाँ भेजना है, इस समय पे भेजना है, Saturday Sunday off है तो उस समय, तो that needs to be thoroughly emphasized. Demand side financing needs innovations. Target scarce resources है. Actually India is a resource constrained country, and the magnitude is humongous. So we need to be very careful allocating the resources. It involves the private sector also, links with the government linkages also, preference to users, and output or performance based होना चाहिए. There are some organization which have voucher system and everything. We have chithi system in ICAM. We give out the cheats and we write down the day on which they have to come with all the preparation. So unka incurring expenses can be saved. Examples are education में invest Bangladesh ने किया तो Bangladesh could give out good sustainability model. Similar IMR and MMR Gujarat state. Gujarat, we can learn so many things from them. Now, which are the pros then? So, pros are it targets the subsidies, performance-linked payments, provide competition and quality, user choice is there, the consumer are empowered, and it encourages innovation, PPP promotion. But which are the cons then? So, it needs high administrative cost, complex to set up, targeting difficulties only, so and leakages and abuses are there, collusive behavior, moral hazards and cream skimming, weakening public sector, issues around capacity, skill and system. But if we set up rightly, this can be solved at any time. Health and eye care financing has prime focus on poverty reduction also. So it only treating blindness does not mean that just a patient is seeing the world, but his family and socio-economic condition is also improved. That must be kept in mind. So we are doing a good work. Escalating healthcare cost, further impoverishment can be reduced, protection of low and middle income countries population, because as we are seeing the India is marching ahead with the development where the middle class is coming up, and if we take care of their eye care services, they can utilize those resources saved on eye care can be utilized for other developmental activity and human resource development. So if you want to develop a sustainable plan, you need to ask yourself a question: how do you plan to obtain long-term programmatic or institutional support? Question 2 is, how do you plan to get community support? Third, what will be in-country support, be it for salaries, commodities, consumables, equipments, volunteers? And question 4, at what time this can be introduced? And question 5 is, how does the organization plan to get political support in the form of grants and everything? And question 6 is, describe plans for continued financial support. It's not that you have made a program for a week or a month or a year. It must be long-term program. So strategies involve fees for services, how much fees to be kept, how should we go about it. National and international donors must be considered. Income generation activities needs to be focused. In-kind support must be there. Collaborative intervention must be there. Cross subsidies, consultancy services for fees, self-sustaining activities internally, community network, corporate support, and fundraising components can sustain our activities very well. Strategies for organization or program are institutional vision, mission and values. We should not compromise on that. Staff competency must be there. Institutional evaluation system, feedback system must be there. Regular performance reviews are there, and particular third-party evaluation, as Jagdeep sir said, that third party must evaluate the thing, and we need to be ready with the change, adapt and flexibility according to the community. Community does not mean the poor of the poor. Community means your clientele. All the sections of the society must be coming to you and you must sustain it thoroughly. So community support must be there. Community leaders are to be taken into confidence. Networking collaboration is the key. Lobbying and pressure groups must be there. Media management and meetings are very crucial, because little problems will be highlighted in media. So whatever we are doing good must be highlighted now. This is the busy slide, but you can just can Google it. It's like Rodney Knight has designed one sustainability algorithm for Orbis International. It gives everything what I described in my lecture. This is also busy slide. Same thing, you can download it from Google. There are sustainability planning tools are available which are free, and WHO site also having that, so you can download it and you can put your data into it, and you can actually take out what fits for your organizations or hospital. So that ends my talk here. Thank you so much. If any question from your side, happy to answer. Thank you.
Thank you, Dr. Rohan, for elaborating the role of NGOs in achieving the curable blindness, the goal of curable blindness. Any question from the audience?
Dr. Rohan, regarding financial sustainability, I want to know that how much Ayushman Bharat scheme is helping you.
Actually, Ayushman Bharat scheme is helping, at least in Gujarat state, very well. Most of the NGOs are happy. Payments are released regularly, and it is like more than whatever is given under DBCS or something. So in Gujarat at least is going very well, but in other states there are some difficulties of like regular payment and everything, and it requires so many certification and everything. So that's the bottleneck, but most of the NGOs, they can get through it nowadays, because all NGOs, they are now establishing themselves, complying to the protocols. So I think PMJ is giving good results, yeah.
Thank you.
Thank